start recording. We encourage you to show your love and passion for everything that we are sharing today. Please use the reactions icon located at the bottom of your screen, so it looks like the little smiley with the plus face down there. Let us know how you're feeling by sharing emojis liberally throughout our event. While our speakers are presenting, please use the chat feature to ask questions and interact. Ian, one of our many wonderful Colorado Health Network team members, will be monitoring the chat for questions. And there will be plenty of time during our question and answer and discussion portion to interact directly and to answer and ask questions of our speakers today. In 2022, Southern Colorado Health Network served 166 women living with HIV in Southern Colorado through our non-medical case management and medical case management services. In addition, we provide dental services with Howard Dental, behavioral health care, prevention programs, and emergency financial assistance for things like transportation, food, housing, utilities, and other fundamental services to ensure that women living with HIV have access to life-sustaining resources. At the center of services and programs offered for women and girls who are living with HIV or at risk of HIV infection is the desire to ensure that they are empowered to take care of their physical health and emotional well-being. Today, we are highlighting health and creating a safe, open space for discussion on services and supports with Dr. Betsy Kleiner. Everybody give Dr. Betsy Kleiner a wave here. Following this, we will hear from Renee Kuntz, who will share her story as a longtime advocate and client of CHN. We will wrap up today's luncheon with some discussion and Q&A. At this time, I am honored to introduce Dr. Betsy Kleiner. Dr. Kleiner resides and practices here in Colorado Springs as an infectious disease specialist. With over 20 years of practice specializing in infectious disease, she has been a constant participant and witness in the strides we've made in our fight against HIV. SCHN has benefited from Dr. Kleiner's experience many, many times throughout the years, and we are once again honored as she joins us this year. It is my honor to introduce Dr. Betsy Kleiner.
Hey,
Let's
everybody.
give a round of applause.
First of all, as you can see, it's a little backwards day on my screen because I'm obviously having some technical issues, but it's all good. So welcome, everyone. I'm really glad you're all here to join us. National Women and Girls HIV/AIDS Awareness Day is observed each year on March 10th, all across the United States. And it's at this time that local, state, federal, and national organizations come together to show the support we have for women, girls, and femme-presenting individuals to shed light on the impact of HIV and AIDS. We're going to first kind of go through a couple of numbers. And the numbers have been a little squirrely in the last couple of years because 2020 access to testing and healthcare was really impacted by the pandemic. But if we look at where things are, they do seem promising. The number of women and girls diagnosed with HIV has decreased when we look at our numbers. That is no reason to stop what we're doing, but it shows that we're making progress. But there's still much progress to be had because our goal is to eliminate HIV and new transmissions of HIV in our communities. In recent years, approximately 7,000 women have been diagnosed with HIV, and that's as of 2019-2020 numbers. That most impacts women ages 20 to 39, which accounts for 19% of those women. We know that advances in testing, treatment, prevention have resulted in progress because ultimately our goal is to end the HIV epidemic by the year 2030 here in the United States and overseas and abroad. This year, the focus for Women and Girls HIV/AIDS Awareness Day is prevention and testing at every age, care and treatment at every stage. So a couple of things I just want to go through first, just to talk a little bit about where we are and some things that I think are important for us to talk about. First of all, why are women affected by HIV? It is estimated that in the United States, 1 in every 4 people living with HIV is a woman. And most women contract their HIV through heterosexual sex. Some women may be, and why is this? This is because of multiple reasons. 1, some women may not be aware of their partner's risk factors for HIV, IV drug use, having sex with other men, and they're not using condoms. Women may be afraid or unable to talk to their partner or leave their partner due to any sort of emotional or physical things that may be going on, or it may be a relationship where it's difficult to discuss condom use. In general, women are less likely to be tested for HIV compared to men. And that is something that we need to work together as a community to change. And then finally, unprotected heterosexual sex is associated with a higher risk of HIV transmission for women compared to men engaged in heterosexual sex. So the vagina has a large surface area, way larger than the male's penis, no matter what men may say, okay? And so it's important that we recognize that that large surface area that a woman has facilitates more area that HIV exposure is shown to for the body. In addition, semen can stay in the vagina for days after intercourse, which means that our duration of exposure is longer than it is for a male. In addition, if women are not getting tested and treated for other sexually transmitted infections, there's the risk of contracting HIV is much higher if you have a concomitant vaginal yeast infection, bacterial vaginosis, or any sort of untreated sexually transmitted infection. And that risk can be increased by 2 to 5 times. So these are issues just related to our anatomy as women or born with and assigned as women that put us at higher risk with sexual intercourse. And then furthermore, anal sex without a condom is much higher risk than vaginal sex. And so those of us that engage in receptive anal intercourse without a condom, that risk is far higher than it is with vaginal sex as well. So that's why we are affected as women and why we need to take control of our health. And so I think when we take control of our health, there's a couple of things that we're going to talk about. We're going to talk about knowing your status, how to protect yourself. And for those of us living with HIV, get into therapy and get an undetectable viral load. So to start with, know your status. It is estimated that 1.2 million people in the United States have HIV, and 13% of them do not know it. And that number's down. It used to be close to a quarter of them. And so we're making progress, but there's still a lot of work to be done. And so it's important to get tested. Knowledge is power. HIV is a treatable infection. I always tell people, do you know people with heart disease? Do you know people with diabetes? Well, those are a heck of a lot harder to treat than HIV. And so knowing your status can be life-changing, not only for you individually, but for our community. Knowing your status helps to protect you and also helps to protect your partners. If you think you've been exposed to a sexually transmitted disease and you go in to request screening and treatment for gonorrhea, chlamydia, syphilis, herpes, get HIV tested at the same time. That is an important opportunity that we all need to make sure we advocate for ourselves and for others. Remember that having another sexually transmitted disease, such as herpes, syphilis, and even things like bacterial vaginosis, they make you 2 to 5 times more likely to contract HIV than if you did not have that STI. So again, taking care of our total sexual health is essential. There are plenty of places to get tested. That's the beauty of Carter Health Network. They make access to testing so easy. And so again, it's really important for us to encourage our communities to get tested. So the next piece is protect yourself. There's so many different ways to help protect ourselves, but one of the most underutilized and important pieces that we can put in our tool chest to help protect ourselves is PrEP. What is PrEP? PrEP stands for pre-exposure prophylaxis. And what PrEP is taking a medication that can help to reduce your chances of contracting HIV. PrEP is extremely effective if used correctly. It is estimated that if PrEP is taken correctly, it is 99+% effective in preventing transmission of HIV. That is unreal, amazing. We know it does not protect against other STIs, so it is important that if people are PrEP, to get screened appropriately and frequently for other infections such as gonorrhea, chlamydia, syphilis, and oftentimes Hep C. PrEP is well tolerated, it's safe, has minimal side effects. If people do have side effects, those side effects wane over time. And PrEP helps us to empower ourselves and our communities to take control of our sexual health. It is indicated, PrEP is indicated for any of those individuals that have an HIV positive partner and that partner does not have an undetectable viral load or has an unknown viral load. It is indicated for any of those that are using injection drugs. It is indicated for any of those that have had a sexually transmitted infection in the last 6 months, and for any of those that are having sex with multiple sexual partners and not every time using a condom. And I offer it to anybody that's just interested in having it. So there's several options for PrEP. Truvada, I'm sure you've all seen lots of commercials for Descovy, and then Apretude or Cabenuva. And the key thing for women that's important to know is that the two options really for women at this time are Truvada and Apretude or Cabenuva. Descovy, which has a gajillion commercials, is not right now indicated for women, or I should say for anyone who was assigned female at birth, because it has not been fully tested in that group of individuals. And so our options are Truvada, which is a once a day pre-exposure prophylaxis. And then our other option is Apretude or Cabenuva, which is the injectable PrEP form. And that's an injection that's taken every 2 months. When they go head to head, compliance with Cabenuva or Apretude, the injection, is very high. And that helps it to be oftentimes a better option for folks. It is essential for to reach that 99% efficacy. It is important that people take PrEP as prescribed. PrEP is readily available. I have a lot of primary care doctors in our community that are prescribing it. Colorado Health Network can hook people up with getting to those right resources, and certainly infectious disease helps as well. So PrEP, an important tool that is being underutilized. It is estimated that in all comers, people that are at risk for contracting HIV, only 25% of people that are eligible for PrEP are on it. And those numbers for women are much lower. It's estimated only 10% of women that would benefit from PrEP are on PrEP. So this needs to continue to be a point that we educate and sound the information on to get people engaged in pre-exposure prophylaxis. Other things that help to protect ourselves: mutual monogamy, being sexually active with only one person and making sure that person who you're having sex with is only having sex with you. So mutually monogamous. That is one of the best ways to stay, again, safe sex and minimize risk of other STIs as well as HIV. Talk about it. Talk to your partner about sex and HIV. Learn about your partner's behaviors to include sex and drug use. Consider the risk before having sex. Consider getting treated before you engage in sex with a new partner, that you both get treated so you know your status. Use a condom. A latex condom consistently and correctly used every time obviously is extremely effective in preventing HIV as well as other sexually transmitted infections. Obviously for women, that's a difficult issue for us to sometimes promote that because we aren't in control of that piece, and that's where PrEP is a really important tool for us. Don't share certain items. Don't share needles. Don't share syringes. Don't share drug works. Clean your works with bleach. Remember that HIV is not contracted by casual contact, sharing straws, kissing, sharing utensils. This is not a risk factor for HIV. Don't use drugs or alcohol with sex. I mean, the hard part is we don't make good decisions when we are intoxicated with drugs and alcohol, and it can impact our ability to make good decisions when it comes to potentially high-risk activities. And then, of course, abstinence is 100% effective, but usually these other ones above are more important because sex is fun. And so people want to engage in sex. They want to do it in a fun and safe way. So my next piece I'm going to talk about is living with HIV. Living with HIV has been a game changer in the last 30 years. I think the key thing living with HIV is get into care, get undetectable, and stay undetectable. When I have patients that first come see me and they've been diagnosed with HIV, they kind of feel like their world is caving in on them. And I just remind them about the patient, their friends that they know that have heart disease and diabetes and high blood pressure. And let's count how many pills they're on. And let's count how many complications they continue to have despite being on those pills. And the amazing thing is that we have such a broad range of treatment options that are so simple, so well tolerated, and they are getting better every year. And the best thing about getting someone on treatment is not only do we help protect that individual, but we also protect our entire community, because we know that undetectable equals untransmissible. That's you equals you. And so by taking the step of taking care of your own health, you actually take care of the health of the others in our community. Studies have clearly shown that people that enroll early and engage and follow up on their care with an HIV provider live longer and live full, healthy lives. Obviously, we prefer to people to start therapy sooner rather than later. But I have patients that I engage in care and their CD4 counts are 3. And guess what? With our medications, we can get them to where they are feeling well and they are participating fully with everything they wanted to do with their lives and reaching their goals. HIV does not define people. It's just a part of us, just like our health with diabetes and high blood pressure, that it's just a part of us that we have to take care of our health. But I think one of the barriers that we face for women is that sometimes access to care for women is complicated. We are the backbones of our community. We work long hours. We are working mothers. We have childcare issues to address. We may not have access to transportation that makes things easy for us to do. And those barriers are things that Colorado Health Network, as well as other communities, are working to address and things we need to continue to address, because those barriers need to be overcome so that everyone living with HIV can participate in top-notch care to live full and healthy lives. The other thing is that it's important for women to think about a couple things that are specific to us and special needs that we need. And so one question I have is, can I get pregnant? And the answer is, of course. Engaging with your OB and with your HIV provider helps to provide people with opportunities to have healthy pregnancies and healthy babies. That is, having a baby born with HIV is a thing of the past if we can enroll everyone in appropriate prenatal care. There are a couple issues that impact women living with HIV more so than their counterparts. And those are things that good healthcare can help overcome. And those are things such as cervical cancer. HIV infected women are higher risk for developing cervical cancer compared to women that do not live with HIV. And so having routine Pap exams and pelvic exams can make a difference, and continuing to encourage all individuals to up to age 45 to have the opportunity to get the HPV vaccine so that we eradicate most, if not all, cervical, throat, and rectal cancers is another goal that we should have in providing for the health of our communities and our individuals. Vaginal yeast infections can be more common in women that are living with HIV. And then again, as we talked about pregnancy, it's important to make sure that we're family planning so we can give comprehensive medical care. I think I'm going to stop there unless anyone has any specific questions and turn it over to the next person.
Oh, amazing information. For those of you who have questions for Betsy, please feel free to pop those questions into the chat and we can get those answered. I know Betsy's just a wealth of information and knowledge, and we are truly thankful to have her join us today and share her information with all of you. So kudos. Thank you, Betsy, so much. Use those reaction buttons. Show some love, share those heart emojis, share the hand clapping emojis, go for it. Have fun, ask your questions, please. Nationally, our overall goal is to raise knowledge and awareness levels for all of our community members. And I know, Betsy, you mentioned some of these statistics earlier. 1.1 million people aged 13 and over were living with HIV in the United States in 2020. During that year, it was an estimated, and this is an estimate, 30,635 people received a new HIV diagnosis. So, definitely some things to think about as we're working through and learning more about women and girls in this process. Of those new infections, Betsy, you mentioned 18% were women, and most of those were individuals 25 to 34. So as we're thinking about these statistics and we're learning more information, I'd love to be able to transition to introduce Renee Kuntz. On September 13th, 1993, Renee Kuntz's life changed as she knew it when she was diagnosed with HIV while 5 months pregnant. Instead of being scared, depressed, or trying to hide this illness, she decided to become an advocate in helping others. Her goal now is to educate, support, and share her personal experience. Renee has been actively involved in her church's HIV/AIDS ministry at Emmanuel Ministry Baptist Church since being diagnosed, where she is currently the ministry leader. Renee has been a client, collaborator, and past board member with Southern Colorado Health Network. She currently serves as a board member with Angels Unaware, a nonprofit organization that provides support and encouragement for children living with HIV. HIV is both a personal and community issue for Renee. Please help me welcome Renee.
Okay, probably helps for me to unmute. Can everyone hear me? Just thumbs up, claps, whichever, to let me know you can hear me. Can you hear me?
You're good, Renee.
We can hear you.
Yeah.
Okay, perfect. All right, I appreciate that. And thank you so much, Jamie, for the introduction. Listening to Miss Betsy, she sort of took some of the stuff that I was going to say. So this will probably be even shorter than what I have to say, but that's okay. Some of the people who are listening on here are probably amazed because I told them I can only speak for 5 to 7 minutes. And someone was saying to me, are you going to be able to stick to that? But I have my trusty timer set, so I will know not to go over my time. But as Jamie introduced you, myself, actually this year, September the 13th will actually mark 30 years that I have been diagnosed HIV positive. And listening to Dr. Kleiner when she said the changes that have occurred in the last 30 years, that it is amazing. When I was diagnosed at that time, it was still considered a gay white man's disease. So for women, especially those of us that were pregnant, it definitely was something new. I was blessed and fortunate to be able to be a part of the testing of AZT, which now most women were taking for when you, as soon as you were diagnosed and if you were pregnant. And I can say that my son was not diagnosed as HIV positive. So I was glad to be able to be a part of that program and to be able to take that drug. I sit back and I think about what I was told as a woman at that time, what my options were. And it's sort of interesting to think now, especially in the environment that we live in now in some places, that I actually had an option with my body at that time. The doctor gave me different options, which obviously one at that time was also considering abortion. I, of course, for those people who know me very well, know that I am a very spiritual person. So I do a lot of things within prayer. So I had to sit back and think of the pros and cons of, what my decisions were going to be. And I obviously chose to go ahead and continue with my pregnancy, even though I was told so many different things of what would possibly happen. At that time, you're told the child may not make it, you may not make it. If you do make it, your life as a female is not going to be the same. You may no longer date. You will not be able to probably see your children. You will not get married. Well, obviously that was what was probably told to us. because that is not true for myself. I was obviously able to give birth to my son, who is now 29 years old, who has blessed me with 4 grandchildren. I was able to get married. So those things that I would have thought about that I was going to have to give up on were not true. So one of the things I've learned going through this is that we can't allow the disease itself to define us. And anyone that also knows me knows I do not let this define me. You have to figure out your voice, and you have to think of, not, even though you may have been diagnosed, it doesn't define that's who you are. I made a decision when I was newly diagnosed that the first thing I needed to do was to educate people. And I just definitely went about talking to my church. I joined groups. The Southern Color AIDS Project was definitely there for me. My sisters in Montana, it was great having that support group. It's just that we as women have to learn to empower ourselves. Even if you're, I know Dr. Betsy spoke about the things that you can do to prevent that. I think some women don't take that empowerment of demanding and saying, we need to have a condom on, or let's go and get tested. Those are things, if you're able to go ahead and have a conversation that you're going to be intimate or have sex, whichever way you want to put it, then you should be able to empower yourself and have the conversation of, okay, what is your status? Or let's go and get checked together. Okay, if we're not willing to do that, then we need to stop and not do it, because you have to protect yourself. That's the only way you can do it as a female, is to protect yourself. This year I'll be 60. We are living much longer. I think of this day to honor those women who sadly are not here with us, that went before me those 30 years ago. So I do take time to pay homage to those, but I'm also here to support those women who are trailblazers, who are advocates, who are out there trying to teach others, especially us women, how we can survive and get through this, because we know it's not a death sentence. Just like Dr. Betsy said, it's about being undetectable, untransmittable. I'm blessed and fortunate to say that that is the category I myself have been in for years. So when you think about this day, really think about empowering yourself, but also just thinking, what can you do to help encourage women that are going through this? Is there something that you can do to support them? Like I said, my main piece is just trying to talk to people, whether they're newly diagnosed or even educating people who may have myths of what they think this disease is about. I believe that that is my mission. That's what I'm here for, and that's what I will continue to do. I enjoy speaking to people about this. I'm not someone obviously who's shy to speak, but I do take my time to make sure that people know exactly about this disease and how to prevent it. And that's all I've got for today.
Wow. Let's give Renee some major applause here. Share the love. Please pass your questions along to Renee in the chat. Very powerful message and wonderful information. Thank you so much for sharing your story with us. It's truly inspiring.
Thank you for inviting me.
Absolutely. The vulnerability really that you've shown is just amazing, and something I think we could all take back with us. So beautiful story. Thank you. At this time, we're going to switch gears just a bit. And I am excited to introduce Amanda Ford, who is one of our outstanding let me make sure I get this right, youth advocacy programs assistants here with Southern Colorado Health Network. Amanda is currently double majoring in international business and global politics at UCCS. She joins us with experience in local government and campaigns, and her passion is community fieldwork. We ask that you engage during our discussion, and please share your responses, comments, and questions in the chat. Ian will either ask for you to share or share your question or comment from the chat, So kind of a bigger way that we were able to do a lot of communication. I know Amanda is going to walk through kind of a unique way for us to be able to share some interaction as well. If you happen to be attending by phone, Reed, did we have anybody attending by phone? I want to make sure we capture those folks as well.
I believe there are 2.
Perfect. If you are attending by phone and want to interact and put some comments in there, please press *6 to unmute to share and ask your questions and comments during this discussion. I am honored to turn over our luncheon at this point to Amanda to offer some space for conversation on prevention and testing at every age, care and treatment at every stage. Welcome, Amanda, and thank you.
Hi, everybody. Thank you so much, Jamie. Like Jamie mentioned, I'm the Youth Advocacy Programs Assistant for the Southern Colorado region. Today, we have a Mentimeter discussion with some good discussion questions to follow up the awesome conversations from Dr. Kleiner and Renee. So I'm going to go ahead and share my screen. We'll have 2 discussion questions, and there will be a link that you can type in on your phone with a code, and you can put your answer to those discussion questions in through that link, and they'll all pop up on the screen, and we can take a look at them. So go ahead and share my screen here. Let's see. Can everybody see this first slide? Just give a thumbs up, maybe.
It's awesome.
Perfect. Yeah, so this is our first discussion question. And if everyone wants to just take a second to kind of think about that, soak it in, and then you can go to that www.menti.com website and then just use that code and you can type in your answer and they'll all start popping up. Awesome. And I think Leah just put that link into the chat if anyone needs it. It's right there.
Amanda, this is Jamie. For those who don't have access to their phone, and I know there's a couple folks joining us on phone call and may not be able to see the screen right now. If those individuals would like to press *6 and interact with the questions, can they go ahead and do that at this time too?
Yeah, absolutely. So that's a great idea. We'll kind of take this moment right here for anyone who might not be able to access the Mentimeter to pop into the chat here and discuss their answers.
Amanda, could you share the code with everyone? I think some folks need that.
Yeah, I can share the code. I'll put it into the chat right now.
And Amanda just shared the code in the chat, 6567012. 6567012.
Alrighty, and it looks like we've got a couple of answers popping up, so we'll wait for we get a couple more.
Amanda, this is Jamie again. While folks are looking at entering those into the chat, for those of you on the phone and that can't see that, can we read that question out so we can get those answers for anybody who's wanting to reply verbally?
Yeah, absolutely. So this first question here is, how has National Women and Girls HIV/AIDS Awareness Day supported our community throughout the years? How can we continue to grow and change? And if anyone without access has an answer to that, feel free to hop in. All right, looks like we've got a lot of answers coming in here. So I'll go ahead and read out some of these answers that we've gotten just for people who don't have access to the Mentimeter. Bringing acknowledgement to women and girls living with HIV/AIDS. We can continue to grow by listening to more voices of women and girls with lived experience, more advocacy, representation, recognizing the intersectionality of lived experiences. I really like that one. Raises awareness and provides opportunity for action to support women and gender nonconforming folks disproportionately impacted by HIV, created space for vulnerability to continue to grow. More could be done from a health equity perspective. We have to consider that those that don't have access and help them improve their access and knowledge, empowerment, advocacy, bringing the community together for education and advocacy is super important, promoting advocacy and raising awareness. The Awareness Day has been an incredible way to inform the community about an issue impacting women, girls, and not just men. Advocacy continues to be needed. Provide non-judgmental support, informed on reproductive rights and choices, more community-based programs to support women and girls living with HIV, overcome barriers that face women, education empowerment, advocacy and awareness, accessible education about HIV and AIDS, awareness about women's HIV risk. These are all awesome. Is there anyone else in there who didn't get a chance to share out that wants to before we move on to our next question?
Amanda, this is Jamie. Knowledge and awareness came through with supporting our community and also with the offering out of resources that were available.
Awesome, perfect. Is everyone ready to move on to our second question? I think this was a perfect lead in to that next one. All right. Yeah, so obviously with the theme of today's luncheon being prevention and testing at every age, care and treatment at every stage, this first question focused a little bit more on care and treatment. And then our next question, I can pull it up. There we go. Our next question focuses a little bit more on prevention and testing. So you guys can go to that same link and I will copy the code as well as read out the question in case anyone can't see it. So the question is, how as a community can we specifically support making prevention and testing services accessible to women and girls? And I will go ahead and put the code for this one into the chat.
Hey y'all, this is Jamie. That code, just in case you're not seeing it up there, 6567012. And Amanda, while we're waiting for people to pop that information into the chat, if folks would like to add some questions into the chat for, at this point, for anybody that's joined us today, for Amanda, or gosh, for just any questions out there, let's do that as well. This is a great opportunity to kind of build up those questions so we know what we're looking at.
Awesome. And I can go ahead and start reading off some of these as they come through. Again, that question, how we as a community can specifically support making prevention and testing services accessible to women and girls, offer testing and prevention strategies at every physician visit. That's something we've been doing at UCCS. Education, 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 identifying underserved communities and going to them instead of them coming to us, maybe through mobile clinics. I love that one. Including PrEP and PrEP as part of sexual health education for people of all genders, offer testing clinics and education sessions at targeted sites, break down stigma, offer more resources in school, discussion with the women and girls in our lives about risk, testing, PrEP, etc. I really like that one. Targeted marketing and education of PrEP to women and girls, having info available that's specific to women and girls, like Doc was saying, make HIV testing a regular procedure during regular physical checkups and women wellness checkups, make sure women know they have to sign consent for HIV test, raise more awareness around PrEP. Many PrEP clients are either MSM or AMAB, increasing awareness, removing barriers, culturally competent care, trauma-informed care, increasing community outreach efforts to reach this population. Those are all fantastic ones. Is there anyone who doesn't have access to the Mentimeter that wants to hop in here, or everyone had an adequate chance to reply? Perfect. I don't see anyone else.
Amanda, this is Jamie. Are we able to collect these and maybe share these out? I think these are wonderful responses. And if we can maybe do something with these rather than just sharing them out, I think it would be great movement.
Yeah, absolutely. I can save all these responses into a slideshow and I can email that over to you so that we are able to kind of like take this little brainstorming session and then potentially use it moving forward.
That's amazing. Thank you.
Of course. Thank you so much for giving me a moment to hop in here and facilitate some discussion. I think this event was super awesome. And thank you for Dr. Kleiner and Renee for speaking. Both of their segments were amazing.
Amanda, thank you.
Of course.
I-
I'm going to stop sharing my screen if that's okay with you, and then I'll save this.
Absolutely. Amanda, thank you. That is such a cool way to be able to show and spotlight information and discussion, and to be able to kind of prompt our next section of this, which is really, I think, a cool piece that we're all here to really want to do, which is open up and discuss and ask questions of our speakers today, and really get to know what personally we want to ask about. This is a safe space to be able to get to know what we need to know. So at this time, I would love to be able to share out questions to Renee, to Dr. Kleiner, to anybody really here that's a resource to us. And if Renee or Dr. Kleiner are able to answer these questions, that's what we're here to do, is to get these answers to you as part of our community. So please feel free to pop your questions into the chat. If you're on the phone, *6 to unmute, and let's ask these questions and let's get this discussion started, because we've got some amazing resources here right now.
Hey, Jamie, while we're waiting for questions to come in, do you mind if I just back up and talk a little bit more about PrEP?
Oh
Just
my
'cause I
gosh,
think it's
please.
a tool that for women is a really important one. It's underutilized. So
Please do.
like I said, pre-exposure prophylaxis, highly effective, and underutilized in women. 10% of people that are candidates are on PrEP for folks assigned female gender at birth. And I just want to go through the pros and cons of a couple, just so people are aware. So there's 3 agents that are available to use. Truvada is definitely the most studied regimen, well tolerated. It can also be used as an event-driven therapy. I have some patients that go on, but stays in Vegas is what happens in Vegas, and I only need it when I go to Vegas, or things like that. And so it can also be used as an event-driven process that people then make sure they use for 28 days after that event. It's very well tolerated. It's very easy for primary care doctors. We need to empower our primary care doctors to start helping to provide this to their patients, because this is not a difficult and very effective intervention. And the key thing is making sure that we know people's hepatitis B status. The next one is Descovy, which again, I'm not going to touch upon as much because it really has not been adequately studied to be utilized in individuals that were born and assigned female gender. But then I want to talk a little bit about cabotegravir, which is the injectable option that is new. I think you see a lot of commercials for the HIV treatment for it rather than the PrEP. The PrEP version is called Apretude. It's an injection given every 2 months. It's highly effective, and it appears in some studies be more effective for women than Truvada. And again, I think that may be due to the fact that it's easier for compliance. Compliance is important because there is a window during that every other month when you get the injection that you have to land inside that 7-day window to ensure that we don't have a lapse in efficacy. I think that it's a little sore on the tush, not going to lie, but I think people get used to it. And in addition, I think that injectables, we're just seeing the the tip of the iceberg. I think that we'll be moving towards more long-acting treatments and preventative management. And this is just the start of what's going to be an amazing revolution in HIV therapy in the upcoming years. In general, we talk about doing injectable therapy for folks that forget to take pills or unable to store their meds, housing instability, things like that that can make things difficult. It's also a reasonable option for people that have bone disease. So for instance, if somebody has osteoporosis or osteopenia, Truvada may not be the best choice for them. So for folks that have severe kidney or bone disease, the injectable is a good option that doesn't add to those underlying issues. And these things are available readily. There are, the injectable one is a little bit more complicated. I'm probably gonna say something I shouldn't say aloud, but I feel like the company spent more money on commercials than they did on ensuring easy access of the medication to patients. And so how they've set this up is complicated for providers. And so it's very difficult probably for a primary care doctor to provide this because they have to buy the medicine up front and it's quite expensive. But there is now in Colorado Springs an agency that they are just buying this up front and having people come to there so that if you prescribe this, you can partner with this company that's in town where they come in and get their injections there. And that makes it much more reasonable option for people to provide through a primary care doctor's office because before it was out of reach because you had to buy it up front. And that's how we're pursuing it right now at Peak Vista. So that access makes this a very accessible drug for folks, the injectable. Does anybody have any other questions on PrEP? Great, thanks. I just want to provide that extra information.
Thank you. Yeah, lots of comments over here. Super helpful. Thank you. All over. So really good information. Betsy, you're just a wealth of resources and information. Thank you. Renee, there's a question here for you. If you've got some comment about when you started on your journey, people thought really that HIV was a gay white man's experience. The question centers around, what does this look like? Because you are not a gay white man. What is your experience and it was clarified in the comments, as a Black woman living with HIV?
Okay, I think this is Leah's question, I do believe, right? Yeah. So when you say my experience, I guess, so I'm just sitting thinking, I never thought of it, I guess, as a Black woman or male situation. I never put myself, I guess, in that type of category. So I guess that's one of those questions I'll have to think about. But I think that actually, when you say that, I know when I went to get tested, excuse me, like I said, I was diagnosed when I was 5 months pregnant. HIV was not one of the tests that I was going in for. My doctor, because my lymph nodes were swollen, and I had mentioned it to him, and he was like, well, we're going to do all these tests. And he just happened to mention, we'll also do an HIV test. It wasn't something that was obviously on my radar, far from it. So when he said, we are going to test you as part of that, all your tests, and I'm being very honest, the first thing I did after I left his office is I went to the library to go read up about it because it was still so new. And I found one book and it had a very short paragraph for women. And it said, if you are HIV positive or have AIDS, 25% chance that your child will get it and not live to the age of 5. That was it. That was all the information I had to go off of. But what was sort of interesting to me is that my doctor, who I had had since I was 18, he said to me, even though I'm doing an HIV test on you, don't worry, because you're not high risk. You don't fit the stereotype. And even to this day, that just amazes me that he would have said that, because it's like, well, what's high risk, and what's the stereotype, which I knew what he was talking about at that time. So I think that was my first moment of, okay, you really, you don't fit the mode of someone who's HIV positive. Well, obviously the test results came back a little different than what he also expected. But the fact that he said that is sort of opened my eyes, and which made me to know that I needed to go out, because my first thought was, okay, if he's thinking that, then when I share my story, others are going to think that. And so I noticed that people would ask me questions like, well, did you get it from using drugs? Did you get it because your mate was practicing on the down low? And then I found out later on, it was because people were trying to not have it be something that they themselves could relate to. So when I told them it was heterosexual, of course, now it's like, oh, no, I don't do drugs. I'm not out there on the streets hanging out. I don't, sleep with many partners. This was someone I was engaged to be married to. So it was a monotonous, at that point, monogamy type relationship. So when I do speak, I speak more so, as we were saying, to talk to women. I talk to youth. I knew that I had to speak to my Black church, because again, that's the part where I tied that into. I knew the number one groups that I wanted to talk to was my church, coming from a Baptist church. And then I wanted to talk to the youth. Those are my two focus groups that I focused on, because I felt like if I could get it, then that means that anybody else was susceptible to getting it. But yeah, I've never, put that part, but I have noticed as I've done this for a while, that the numbers for African-American females is much higher. And so those are things that I am learning more about and trying to make sure that I do a lot of speaking on that as well. So hopefully I've answered your question. I see you nodding. Okay, good.
Thank you so much. Truly, the questions that are coming in are absolutely amazing. I see everybody kind of collaborating and really kind of throwing in some answers to those. Thank you for everyone for providing that information. Renee, thank you for providing perspective. Betsy, thank you for providing resources. Oh my gosh, this is so amazing. Honestly, to be able to see this information, to be able to share this information, and really just to be able to get together and talk about what progress has been made and where we are today in our community. I can't believe this. Our time has really come to an end today for our National Women and Girls HIV/AIDS Awareness Day. At this time, I would love to once again thank Dr. Betsy Kleiner, Renee Kuntz, thank you, Amanda, thank you. Southern Colorado Health Network really has made great efforts to ensure that we are reaching the folks that need the support, that need the HIV testing, and really making sure that those individuals living with HIV have access and really are here to support with life-saving medications, with care. Additionally, we really all must be vigilant in supporting our prevention and testing at every age, and care and treatment at every stage. As we conclude our event today, we want to encourage everyone to ask questions, to seek support with prevention, testing, care, and treatment, and to share the information you've heard today, because we know that this will bring further awareness. As always, Reed, if you wouldn't mind, can we bring up that one last slide here? Because one of the things that I love to do, as always, is promote the support that we're able to offer, and we can't do this without everyone's help in our community. Colorado Health Network's programs and supports really are here as part of a community effort. The QR codes up on the screen now are directly linked to our donation page. Please consider donating to help us provide these further healthcare services and HIV education programs across Colorado. If you would like more information, please go to coloradohealthnetwork.org. All of these funding, supports, resources, and information today really helps support women and girls and everyone right here in Colorado. To our guests, thank you for joining us today. We truly look forward to seeing you again next year. Thank you, everyone, and have a wonderful Friday. Thank you.
Thank you.
And again, we need some music. We need the background, right? I have to remember that. Take care. Have a wonderful weekend. Be safe out there, everyone.
Renee Coons, thank you.
Thank
Bye.
you.
Thank you.
Bye.
Thank you.
Thank you, Dr. Kleiner.
Thank you. Thank you. I know, right? What amazing information. Oh, yay. So much fun.
I'm trying to
I
figure out how to
can't-
log off. Mine is being crazy.
Oh,
Hey,
no.
Jamie, great job.
Oh,
Yes, thank
that's
I
you.
just
it.
want to tell you, you
I'll
did
work
a
together.
fantastic job.
Thank
Good
you.
job
Yes.
facilitating. Was
Thank
excellent.
you. Oh, I can't do it. All I did was say here, welcome. You all are truly wonderful in sharing this amazing information. Reed, Ian, thank you so much for the background and behind the
Yep.
scenes support. Did Amanda log off? If Amanda's still on, I don't see her. Thank you, Amanda. And Hermela, I know there was a lot of behind the scenes stuff that went on with this today. Truly, thank you. And Leah, great questions, totally appreciated. So excited.
Okay.
Oh, I am going to stop our recording unless there's any last second items that any of our speakers, presenters want to add to make sure we're sharing on the recording.
I don't have any.
Done.